Symptoms and treatment of cervical erosion. Cervical erosion, or erosion of the cervix, is caused by contracting chronic infections, unusual pH balance, an increase in estrogen levels, and traumas, among other causes. It is an inflammation of cervix cells, which is caused when squamous cells in the opening of the urinary tract turn into columnar cells. This produces irritation, redness, and inflammation, and is sometimes indistinguishable from temporary cervical cancer. Along with this comes an increase in discharge, infertility cases, back pain, and bleeding are a few other symptoms brought on by the inflammation. This is why it is advisable to know its treatments in order to avoid contraindications. What causes it? Any woman could suffer from cervical erosion, although it is more common in women during their fertile years. This could have different causes, but it could come from infections, carcinoma, or some other trauma, like what would be caused during multiple births. It is also caused by chronic and acute infections. This inflammation could even affect young women if they are using contraceptive pills. Along with this, using intrauterine devices for prolonged periods of time, and tampons are common causes. However, this erosion could appear even without frequent use. Also, women of a low socioeconomic status who have multiple pregnancies, marry early, or have poor hygiene, have a higher percentage of suffering from it. Controlling these types of infections is recommendable due to the fact that cervical erosion could cause cervical cancer. Therefore, the duration of time is more important than the type, due to subsequent complications that could arise. The symptoms are Finding out about cervical erosion in a patient is very common during a gynecological visit. However, a lot of women show no symptoms, even though several symptoms could arise. Just to name a few: difficulty urinating, pain or bleeding after intercourse, vaginal discharge or leukorrhea. Even if a pap smear comes back normal, you could still present signs of inflammation and abnormal cells. Cervical erosion causes infections, which are more frequent in the epithelium as it creates ideal conditions for internal organisms to grow in it. That is how the cervix begins to look red and granulated. Other symptoms include neck pain, cervix pain, allergic reactions, eye redness, abdominal pain, bleeding after intercourse, changes in menstrual cycle, burning, back pain. Treatment. Sometimes no specific treatment is recommended, especially for women who are not symptomatic. However, if the person presents pain, complications, and specific symptoms like vaginal discharge or leukorrhea, bleeding after intercourse, and problems with urine flow, undergoing specific treatment is recommended to prevent possible infections and other complications. A few treatments include taking specific medications, cervical cautery or laser cauterization. On the other hand, women that have this infection and still are not sexually active, should research and take control of their health. Now, any irregular result on a pap smear must be treated to avoid the risk of contracting cervical cancer or other infections.